It's darker and it's colder. For some, that can bring on the winter blues. These feelings can be connected to seasonal affective disorder, a form of depression that usually occurs during the winter months. And the pandemic could worsen those feelings as people continue to stay home. In today's A Brighter Tomorrow, KOMU8's Alex Engel tells us how one therapist recommends coping with seasonal affective disorder.
As the days get darker, so might your feelings. But know that if that's the case, you're not alone in feeling down this time of year.
Seasonal affective disorder nationally affects approximately 3 million people.
A form of depression, seasonal affective disorder can be more than just winter blues. It can affect people's daily lives. Outpatient therapist at Burrell Behavioral Health, Gary Lemke, says seasonal affective disorder can occur at any season, but mainly happens during the winter months.
There are cycles, and sometimes we see a little bit of a flux this time of year.
The disorder can have multiple symptoms.
Seasonal affective disorder, what we usually end up doing is we usually isolate, we sleep more, or we try to sleep more. Sometimes we just lay there and we're isolating.
There can also be feelings of sadness, changes in eating, difficulty thinking or concentrating, and loss of interest, according to the American Psychiatric Association.
During daylight savings times, it can feel like it can go from day to night in a snap, and these fewer brighter hours can mean changes to our brain that affect our feelings and routines.
The pandemic isolation could worsen these feelings of loneliness.
We have to socially isolate anyway, so that kind of adds an extra layer to our isolation. So sometimes it actually kind of feeds into more of that depression.
But there are ways to cope.
Keep your routine going by getting some exercise if you can, or at least just walking around the block when the weather's somewhat decent.
Lemke also encourages people to stay in touch with their loved ones safely.
We're still interacting with family, we're still interacting with friends. If they're local, or even if they're not local, we're still in communication with them.
And if you need extra help, contact your doctor or someone that you trust, so that even in the darkness you can try and find the light. For KOMU8 Cares, A Brighter Tomorrow, I'm Alex Engel, KOMU8 News, Columbia.
And seasonal affective disorder can be treated. For more information on how to get help, visit KOMU.com and click on A Brighter Tomorrow under the KOMU8 Cares tab.